Okay, today we will be discussing respiratory acidosis. Well, what is respiratory acidosis? It is a failure of ventilation. So ventilation failure is defined as a rise in carbon dioxide concentration when alveolar ventilation either falls or fails to respond adequately to increased carbon dioxide production. So there is a rise in CO2 that comes along with respiratory acidosis, which is very important to remember. And the most common causes of respiratory acidosis are acute exacerbation of asthma and COPD. Asthma is a diffuse airway inflammation that's caused by dust mites, pets, any household items that you can find, or environmental allergens like pollen. And certain people are susceptible to these allergens and some are not, just based on their genetics. And so what happens in these patients that have asthma is they end up with bronchoconstriction, which causes a failure of ventilation. And then patients with COPD or chronic bronchitis or emphysema, they experience airway obstruction, which is caused by an inflammatory response that's brought on by some sort of toxin. So a good example of this would be cigarette smoke. So the patient may be either inhaling cigarette smoke firsthand or secondhand. They breathe it in and it causes an inflammatory response in their airways, which causes a temporary obstruction. And this also leads to a failure of ventilation, which can lead to respiratory acidosis. So the symptoms of acidosis, which are described by Freydinger and Fadul, are coughing, wheezing, shortness of breath. The patient can experience anxiety or restlessness, become very agitated. Their skin can look very pallor. They can experience cyanosis of the lips, excessive use of the accessory muscles of respiration instead of the main muscles of respiration. There's signs of confusion, feeling lethargic and tired, and in severe cases of respiratory acidosis, you can experience respiratory failure. So the respiratory centers of the brain, the pons and the medulla, they are the control centers of alveolar ventilation. So the medulla oblongata is the primary control center of respiration, and it signals the muscles of respiration and causes them to function and allows the body to breathe. And the pons, their job is more of a supporting role in that it controls the rate of respiration. So how fast the person is breathing is controlled by the pons. The ventilation is also regulated by chemoreceptors. So the body has chemoreceptors for the partial pressure of carbon dioxide, chemoreceptors for the partial pressure of oxygen, and chemoreceptors that regulate pH. And all of this together, these chemoreceptors, they regulate the ventilation process. There are specific chemoreceptors called central chemoreceptors, and those are located within the medulla and are very sensitive to changes in pH. So they're located in a special part of the medulla on the ventrolateral surface, and they detect the changes in the levels of pH, specifically in the spinal fluid. What's important to note is that with the symptoms of respiratory acidosis and the rise in carbon dioxide that we see, that these chemoreceptors over time can be desensitized from either chronic hypoxia, so we see a severe oxygen deficiency, or the increased levels of carbon dioxide that we see in respiratory acidosis. A decreased pH level, as we will see in respiratory acidosis, it influences the mechanics of how we breathe and how we maintain proper levels of carbon dioxide and oxygen. So when the ventilation process is disrupted, the partial pressure of carbon dioxide in the arteries, it increases, and we develop this acid-base disorder. So as bicarbonate, which is a part of the buffer system that the body has, when the levels of bicarbonate decrease and we have the levels of hydrogen being maintained, the blood pH will decrease because there's more hydrogen in circulation, causing the blood to be more acidic. So when the patient is in a state of hypoventilation, the body is just producing way more CO2 than it can ever eliminate through the regular ventilation process. And so the body is causing this retention of CO2, and it's just building up. And these increased levels of CO2 lead to increased hydrogen ion concentration, a slight increase in bicarbonate to match that in the buffer system. And so it's following this equilibrium reaction, as we can see here on the screen. So the buffer system is created by this carbon dioxide. It consists of three main molecules. We have carbon dioxide, carbonic acid, and bicarbonate. So when we have high hydrogen levels, as we were just discussing, bicarbonate comes and buffers that acidic pH to bring it closer to normal. And when we have high levels of hydroxide, the carbonic acid will come and react with that to buffer the high pH and lower it back towards a normal level. So in respiratory acidosis, there's a slight increase in bicarbonate that serves as a buffer for the increase in hydrogen ions that we see. And it just helps to minimize that drop in pH towards being more acidic. But inevitably, the increase in hydrogen ions that we see in respiratory acidosis do lead to a decrease in pH. So acidosis officially occurs when the pH falls below the normal blood pH of 7.35. Carbon dioxide reacts with water to form carbonic acid, which dissociates into hydrogen and bicarbonate. And alveolar hypoventilation leads to an increased partial pressure of CO2, or as clinically termed, hypercapnia. And then this increase in the partial pressure of CO2 in turn decreases the bicarbonate to partial pressure of CO2 ratio, and then overall decreases the pH. So respiratory acidosis can be compensated. And in compensated respiratory acidosis, although the pressure of CO2 is high, the pH is still within its normal range. And this is because the kidneys are compensating for the changes due to the excess CO2 that we see in the blood flow. So the kidneys compensate for the symptoms of respiratory acidosis by the tubular cells reabsorbing more bicarbonate from the fluid. And the collecting ducts secrete more hydrogen and generate more bicarbonate. And we also see ammoniogenesis, which leads to the increased formation of the NH3 buffer. So with this buffering system, complete reabsorption of the filtered bicarbonate is critical to being able to maintain the acid-base homeostasis, because if there's not enough, that balance can't be restored. Another important factor is the ammonia buffer, the NH3 buffer that we just discussed. So understanding the molecular mechanisms of ammonia transport requires recognizing that ammonia, it exists in two separate forms, NH3 and NH4+. And they're in a constant equilibrium with each other in this buffer reaction. So NH3 reacts with hydrogen and creates NH4+, and that's how we buffer the system against the protons. And because this is such a proton-dependent buffer reaction, the actual amounts of the different forms of ammonia in any of the fluids, it varies based on the current pH. So as a result of this, at biologically relevant pH levels, the majority of ammonia is going to be in the molecular form NH4+. And the portion of ammonia that's in the other form, NH3, it's just very dependent on the pH at that time. So the portion of NH4+ doesn't change substantially because the majority of the time with the buffer system, ammonia is going to react with hydrogen and create the molecular form NH4+. So in summary, respiratory acidosis, we see high amounts of CO2 that are beyond the normal and beyond the limits of what the body can expel. And this is caused by failure in ventilation. But this error can be compensated for by the kidneys through reabsorption of bicarbonate and through the ammonia buffering system. Are there any questions regarding respiratory acidosis? All right, if there's no questions, this will be the end of our lecture, and I will see you next week.